Thank you, Chair, and thank you for your presentations. My question, we're dealing with the dueling data, but my questions are going to be around that for Dr. Madras and Mr. Kilmer. In your opinion, and based on the knowledge that you have, Canada's just entering into this this field. Then what should the Canadian government be tracking statistically to ensure Canadian safety? Dr. Madras, can you?
That's an excellent question. I was asked that about a year and a half ago with representatives from the state of Colorado and other states that were troubled with this problem, and I ended up with a 6-page summary of the type of questions that should be tracked, and those were just bullet points.
Maybe shorter.
But I think that the answers are obviously increased episodes of psychosis within hospitals. The drug driving issue is very critical, but the problem is that at present time, if a person tests positive for alcohol at 0.08 or 0.05%, depending on what the regulations are in Canada, a lot of people stop testing at that point. And there is very good evidence that the combination of marijuana and alcohol exacerbates impaired driving. The third, I would, and we can go on literally for 6 pages, and I'll try not to. I think the consequences to youth are critical. How many kids are dropping out of school? How many kids are no longer applying for college? And it has to be related to marijuana. The data we heard about opioid marijuana nexus from my erstwhile colleague, Ms. Margulis, is association studies that have been terribly discredited by epidemiologists because they're not uniquely identified for the individual. They're just state-level issues which don't mean anything. Canada, in fact, has a very good study showing that people who use marijuana are much more likely to drop out of treatment for opioid addiction than people who don't use marijuana, and people who use marijuana are much more likely to use opioids. So, and what I'm saying is extrapolating back to the marijuana issue, you have to not look at overall dropout rates, but overall dropout rates from youth that are using marijuana. Because the amotivation syndrome has been looked at longitudinally, which is a very powerful way of studying the epidemiology of consequences. And there are at least 3 independent studies that show that people who use, as a function of how much they use over their youth, are much more likely to drop out, much less likely to graduate college, much more likely to be on welfare, and much more likely to be unemployed.
Thank you. And not to cut you short, but I wonder if you would forward that. Is it possible you could forward that summary to our clerk?
I would like to put it into the written record because I think it's absolutely critical. What is critical also, and why I would just hope that Canada delays this rush to judgment and rush to conclusion, is to develop pre and post data. Because there's some parameters that you don't have national statistics on that are really robust. And it would be really important to have that database so that you can say, well, from the inception of marijuana, we had a change in this parameter. But I will put it into the record so that I won't perseverate. Thank you.
Thank you, Dr. Madras. Mr. Kilmer?
Okay. Yes, quickly, Mr.
Yes,
Kilmer.
I just want to say I've been impressed with how Canada has taken collecting pre-data very seriously. I consulted with the Department of Health in terms of helping them create their cannabis survey. The results just came out a little while ago. I think that's going to be very useful, especially being able to get the information by province and by territory to be able to begin doing some of these pre-post comparisons, because it looks like there's going to be a lot of variation in terms of how legalization gets implemented in the different provinces if C-45 were to pass. So with that, yeah, definitely paying attention to how much is being consumed and what is being consumed. As Andrew mentioned earlier, so much of the research that is being, that's being cited in the United States right now is all based on whether or not someone used in the past month. From a public health perspective, we need a lot more than that. And so, I know that there are efforts within the Department of Health to collect more information on consumption. You want to keep track of what's happening with the price, and I believe the Department of Public Safety has already begun trying to crowdsource that information. So I think that's quite useful. I do want to say one final, I know I'm running out of time, one final point with respect to thinking about impaired driving and how does cannabis legalization influence traffic safety. You need to pay attention to what happens to overall crashes or overall fatalities. You don't want to just pay attention to the share of deaths where someone tests positive for THC. Yes, in both Colorado and Washington, if you look after legalization, the share of drivers in fatal crashes who tested positive for THC doubled. That's a fact. That doesn't necessarily mean that traffic safety got worse, because THC stays in the body for quite some time, so you can test positive, and it may not impair you by at the time when you get into the accident. And so this is where there's actually new research coming out. There was a paper published in the American Journal of Public Health in 2017, which actually tried to use control groups to try to understand what was happening in Colorado and Washington in terms of total crash or total fatalities. They found no effect. Now, at the same time, there was an assurance.
Sorry.
We can discuss later. Thank you.
Thank you, Chair.
Thank you. I've got to move.